Hey folks, so you might be wondering, I came to the Dominican Republic, I've had my surgery, I've been here 3 weeks, 4 weeks now, I've stayed, I have time off of work, it's either summer vacation or winter break or whatever it is, and I have time that I'm able to actually stay a little bit longer in the country. I want to enjoy a little bit of the country, I want to be able to go to the beach, I want to be able to go to the pool, I want to be able to go hang out. How soon can I get in the water? How soon can I take a bath? How soon can I get in the beach? How soon can I get in the pool? How soon can I start drinking, right? So let's attack some of those questions really quickly. First thing, in terms of alcohol, right? Most people consider, going to the beach, having a beer, having a drink, having, a pina colada or something of the sort. If you're considering having a drink after plastic surgery, especially after lipo, you need to understand that you're going to run the risk of swelling. That is a really, really, really big consequence of alcohol. Number 2, there are suggested guidelines when it comes to when you should be getting wet, when you shouldn't be getting wet, when you should be getting into, water, or maybe water that might be polluted of some sort, or have germs or other organisms in it, right? And so you may be considering going to the beach, you may think getting in the pool, you may think about submerging yourself, but I want you to really strongly consider submerging your incisions that are fresh in water, particularly water that is of the ocean or of the river or some type of a natural source, only because there is so much bacteria and your incisions are not going to be healed yet. Your incisions may look healed and they may seem like they're sealed, but they're not completely impenetrable and they're still not 100% closed, and your skin is not healed inside. And so the best thing to do is to wait a minimum of 6 to 8 weeks before even considering submerging your incisions in any type of water. And that is considering incisions are even dry, that your incisions are healed, that your incisions are looking good, that they're not crusty, they're not flaking. I mean, you really, really, really want to give yourself a good amount of time. If it was me, I would generally wait probably 2 to 3 months before doing any type of those activities. So if you're thinking about hitting the beach or thinking about hitting the rio or the river, as it's called here, while you're out here, I think you're going to want to sit that one out this trip. I think you should wait and come back for one of our snatch and sculpt weekends and enjoy the country at that point while getting your maintenance. But I definitely don't think you should be planning any type of those activities during this trip. You should be really focused on your surgery, really focused on your well-being, really focused on your recovery, that this trip should really be invested in that. And of course, one of the most popular questions and most popular topics that we always come across is sex. So since you've been in the country for 2-3 weeks, since you've been gone away from home, from your loved ones and everybody else, right, you're probably going to want a little bit of loving when you get home. Common question: how often can you have sex, or how soon can you have sex when you get back? You can have sex as soon as you get home, if that's what you so choose. The deal is this: you have to be mindful. Everybody's body is different. Everybody's healing time is different. Everybody's pain threshold is different. Everybody's comfort levels are different, right? And so here in the Dominican Republic, we have a saying: para los gustos se hicieron los colores. For different tastes is what the colors were made for, right? And so for different strokes work for different folks. And so you have to really pay attention to your body. You have to pay attention to what's comfortable for you. Sex should be enjoyable. You shouldn't be doing it because somebody else needs it or missed it. It should be something that you want to participate in, particularly because your body is going to have been gone through the ringer a little bit. So you want to make sure that you're comfortable. Number 2, you want to make sure that if you had a tummy tuck, if you had a thigh lift or arm lift or anything like that, or a breast lift, that you're not aggressive with the areas that underwent some type of a surgical procedure. You don't want to open your incisions. That's not a good look. So make sure that you don't overextend. Make sure that you're not doing anything crazy with yourself. Make sure that you're not, creating stress and strain on your incisions. And meanwhile, be mindful that, you're not going to mess up your body. You're not going to destroy your BBL results. You're not going to, catch a slap on the backside and, have a permanent dent in your butt. Like, none of that is going to happen. Okay, remember, compression, wear your faja, drink water, get your massages, stay up on your maintenance, take your fajas in occasionally. All of those things are what's going to go ahead and help. That's not going to interfere, okay? So don't worry about that. Now, with that being said, I'm going to let you go. The sun is starting to get strong. It's 9:30 in the morning, and I'm already kind of like, starting to get blind, so I'm going to let you go. But we will talk soon. I'll be back with another topic, I'm sure, a little bit later, okay? Happy Saturday.